Hello and welcome to The Nation. I'm Jessie Chahal. The increasing rate of breast cancer incidents in Malaysia hints a lack of awareness among Malaysians. Joining me today are two doyens in the field of cancer research and advocacy, Chief Scientific Executive Officer at Cancer Research Malaysia, Datin Paduka, Professor Dr. Hwang, and the President of the National Cancer Society Malaysia, Dato Dr. Saunthari Somasundaram, joining us. Thank you so much, doctors, for being here. Indeed, a pleasure to speak to you. It is Pink October, and we want to raise awareness with regards to the Pink Ribbon campaign. Let me start off with this. 1 out of 19 women in Malaysia are at risk with breast cancer, and almost up to 50% of women diagnosed were reported to be under the age of 50. Professor, is there enough awareness as we speak today?
Well, I think the Pink October campaign has been absolutely fantastic in raising awareness around breast cancer. So every year you'll see in the month of October, so many companies and societies and other things, just come out and do various activities to raise awareness. And that's been absolutely fantastic, especially in the urban area. That's achieved two things. One, greater awareness about breast cancer and the need to go for screening and early detection, but also greater awareness that breast cancer can happen to anybody, and it destigmatizes the disease. It could happen to your mother, to your sister, to your friend, to your colleague, and it's no longer such a fearful thing. It isn't now a disease that you die of, but rather one that you can survive. And the Pink October campaign is really critical in that journey of making that difference.
Dr. Saunthari, where do you think we are today in terms of awareness?
I think it's wonderful. I mean, as Hwang mentions, the Pink October month is fantastic because it drives that awareness. But it's important to note that the work has to go on throughout the whole year. So the awareness can't just be for Pink October and then we forget about it and then move on till next year. It's something which we have to drive at every single month, every single day. And it's also important that, yes, awareness in the urban areas, because of Pink October, has escalated. It has destigmatized, but we're not seeing that translated into the more rural areas. So we're not reaching the underserved communities who are actually at more risk of late-stage diagnosis because of poorer access to facilities in terms of screening and diagnostics and treatment, and they have the worst outcomes. So they're more likely to die than someone in the more urban areas where you have greater access.
Right.
That's really critical to point out, because in the more rural areas, data in Malaysia shows that women in rural areas are twice more likely to be to come forward with late-stage disease than women in who have the access to private healthcare, for example, and live in urban areas. So it makes a very big difference. If you have stage 0, stage 1 breast cancer, it's essentially almost 100% cure rate. But if you have stage 4 disease or stage 3 disease, the cure rates may only be 40% or even 20% for very late stage. So it's absolutely critical that we get women to come forward with early stage disease that is then curable. And the challenge is, how do we do that with a campaign like the Pink October campaign?
Right. You said it is the most common type of cancer,
absolutely,
but the most curable as well.
Absolutely right. So, gone are the days where we think of cancers as a death sentence. The reality is that there's been so many innovations and so many developments in the world of cancer research that have made many different cancers now potentially curable. So the challenge for breast cancer is, and this is not true for all breast cancers, but certainly there have been improvements across all of the different types of breast cancer. And we really need to make sure that we don't just rely on therapies, but if we can get women to come forward with earlier stage disease, we have a much greater chance of A, saving lives, B, saving money, and C, saving breasts.
And the thing with breast cancer, though, is that it's not like some other cancers where you talk about prevention. Breast cancer is, in most instances, not preventable. Where women, your likelihood of getting breast cancer is going to be there. So it's acknowledging that every single one of us are at risk. It's not sitting back and saying, oh, I don't have a family history, there's no one in my family. Yeah, exactly, that I'm safe. So that's not there with breast cancer. Everyone is at risk. Every woman is at risk, and we need to address that. And women need to empower themselves to help themselves find cancer early.
Within your organizations, for example, at NCSM, what currently is being done in terms of addressing some pressing issues or developments in terms of raising more awareness for these?
I think it's just not raising the awareness. I think it's doing the action, because I mean, COVID has really shown the gaps that we have in our healthcare system. And one of those gaps is access. Access to timely screening, timely diagnosis, timely treatment. And our current public health care system is overrun. And COVID just made it even worse. So for us, it's filling the gaps. So one of the areas that we really go into is that whole idea of health promotion, awareness, screening, and not just in urban areas. We go into the community. Our success story, and something that we're incredibly proud of, is the NCSM Ethica breast screening and detection ecosystem that we've built. So with this, we work with 100 different partners where we actually promote health awareness. We promote health checkups and screening across communities in Peninsular Malaysia, in the underprivileged. It's all free of charge. And from there, we actually do the screening at their home, basically, or at their kampong itself. So we go out to them. We are not pulling people into the system. We are actually going out into the communities.
So addressing the gap and going down on site to where they may be. Prof, in terms of research as well, what are some pressing findings or developments within breast cancer that are really concerning?
Well, I think key is that Asians are being left out in the world of medical research. So, today, for example, breast cancer is 45% of the global incidence of breast cancer is in Asians, 50% of the deaths due to breast cancer is in Asians, and only 5% of the research is in Asians. So we all know that through medical research, we can make better discoveries that will enable us to screen, detect, diagnose, prevent, improve the outcomes for cancer patients. But if this research is not done in Asia, then how do we make those developments in the Asian population? So as an organization, that's what we focused on. So we've now led major studies that have really helped us understand more about Asian genetics and who is at risk of developing the disease.
And what are we understanding at this point?
And so what we now know is that if you take 100 Caucasian breast cancer patients, only 2 of them will be like Angelina Jolie, inherited the BRCA1 or 2 gene. But if you take 100 Asians, 5 of them will have inherited that gene simply because of the population demographics in the Asian population is slightly different. So it's using data from the Asian population, we've now been able to develop tools that we call the Asian Genetic Risk Calculator that helps doctors figure out who to refer for genetic counseling and testing. It's now in 4 hospitals, and we hope that by rolling out our research in more hospitals, we'll make services for genetic counseling and testing more available throughout the country. The second thing that we know is that breast cancer isn't one disease, and we know that to treat the disease more effectively, you need to know what disease, which woman has got which type of breast cancer, and targeted that more appropriately. So for example, some women have got HER2-positive disease, some have got hormone-driven cancers, and others have got triple-negative disease. So our research has shown, and we've built the largest genomic map of Asian breast cancers, and this is now similar in size to the genomic map in the Caucasian population in the US, and that has enabled us to understand the granularity of how Asian breast cancers are different. We've already launched 2 clinical trials that are testing new therapies focusing on the features of Asian breast cancers. And we're using this research to improve outcomes and survival. But ultimately, like Saunthari says, ultimately it's about getting services to the poor and making sure that we can address the disparities between high-income women, where the survival is already 90% 5-year survival, and low-income women, where the survival can be as low as 45%. How do we bridge that gap? So our programs are targeting low-income patients by operating these patient navigation centers or one-stop centers where we ensure that patients are not left out because of the barriers that they face, be it knowledge barriers, emotional barriers, financial, logistic barriers, and so on, making sure that they can come forward for disease diagnosis at an earlier stage, and also making sure that once they're diagnosed, they get the treatment that they require.
But right now, what seems to be glaring is the fact that it is expensive. Treatment and accessibility are deep concerns here, Dr.
So that's where we come in. Hwang does the research, we do the implementation to a certain extent. So as we said, we go out to the people, and in the last 5 years, I think we've provided over 27,000 free mammograms, and we've reached over 50,000 women in terms of the community work that we do. These women then are just not left alone. These women then, we actually pull them into the health systems by making their diagnostics more accessible. So the tests that Hwang was talking about, the genomics testing, the CT scans, the PET scans, etc., we are able to provide them through public-private partnerships. So we work with private hospitals to be able to give them these investigations at a much lower cost. So then we can actually incorporate them back into the public healthcare system with all their tests all done. So it cuts down that diagnosis time, and they are able to get treatment, timely treatment straight away.
Right, a lot of the programs that are run by NCSM, of course, available online as well, also with some of the research that's done by Cancer Research Malaysia. We take a quick break right now. When we come back, a lot more happening here on The Nation. We're speaking for Pink October and breast cancer awareness. Stay tuned. Welcome back. You're watching The Nation. In the studio with me, Chief Scientific Officer at Cancer Research Malaysia, Datin Paduka, Professor Dr. Hwang, and the President of the National Cancer Society Malaysia, Dato Dr. Saunthari Somasundaram. We're talking, of course, about more breast cancer awareness, and research stats are showing that, of course, it is worrying in terms of its numbers, because globally close to 700,000 deaths occurred. This is recent as the year 2020. But here's something interesting which we've mentioned as well earlier, that roughly half or perhaps even more of all breast cancers occur in women who have no specific risk factors other than basics, age and sex. Doctor, our Professor.
Yeah, I wish we could change that, right? Both our age and, okay, I don't want to change my sex, but there you go. So I think that you're absolutely right that the two biggest risk factors for breast cancer is being a woman and growing older. We can't change both of those. But there are other things that we can change that do make a difference. Our research has shown, we've studied more than 8,000 women. And our research, and these are Malaysian women, and our research has shown that women who breastfeed are more likely to have a lower risk of developing the disease. In addition, we show that individuals who during menopause put on a lot of weight are more likely to have a higher risk of the disease. So these are two things that women should know that they can do something about, right? So breastfeed for as many children as you have for as long as you can. And for women who are undergoing menopause, be mindful about weight gain and try to exercise, be as physically active as possible. That helps you for many different diseases, not just breast cancer, but just good general principles
health, right?
overall.
Bringing lifestyle into the conversation as well, what would you say are perhaps more risks to urban women? Are there anything that you've seen during your course of work or through campaigns that are affecting more urban women?
I think with urban women, it's sedentary lifestyles. You know, we sit more, we're behind an office desk, we don't do the activities that you do if you're in a rural place. We drive our cars to the closest car park that we can, or the closest parking lot we can to the entrance and things like that. So it's a lot of the sedentary lifestyle which adds on to the obesity that you talk about gaining weight. That's the major. Of course, there's talk more in terms of alcohol and breast cancer as well.
Yeah, and then especially in women, in Asian women, we've got data to suggest that high intake of soy milk, be it in tofu or other products, may be associated with a lower risk of developing the disease, but we don't know enough. So we ran a cancer prevention trial that showed a small effect of soy on breast cancer risk, and we hope to be able to relaunch the trial now that it's after the COVID, because we launched our initial study during the COVID. We will hope to be able to launch that study to really definitively prove whether Asian women taking soy could have a lower risk of the disease.
Right.
Which is actually opposite to what most women think.
Absolutely.
Most women think that you take soy, that you're actually increasing your risk. So there's a lot of myths out there in terms of breast cancer, and that's why.
How about the one about mobile phones and breast cancer, or
is that
radiation?
Is that
you
put your
it in your
phone next to your breast?
Like they say, if you keep it in your pocket, or if you sleep next to it, and all of that.
And stress. A lot of people talk about stress and breast cancer. So there are a lot of things out there that people talk about, but I think you have to just pull it back to the core. You're a woman and age, and those are your biggest risks. Everything else is just secondary to that risk.
Yeah. So I
Change
think
that.
No.
I think the key message to get across is that breast cancer may be the most unpreventable of the common cancers, right? But, unlike cervical cancer, that could be 70 to 90% preventable, right? Or colorectal cancer, that could be 60% preventable. Or lung cancer, that could be 90% preventable.
Yeah.
Breast cancer, we think, is only 10% preventable. But the key message to get out there is that more and more people are surviving the disease if you get it early. Stage 0, stage 1 breast cancer is almost curable. So the challenge is really, how do we make sure that women come forward with early stage disease, get cured, and at a lower cost? Ultimately, the later the stage, the more likely it is that you'll lose your breast, or you will have to pay a lot of money to stay alive.
These research and advocacy that you both do are extensive. What drives you on a personal level for your level of dedication and passion for this?
Anybody who knows me knows that for me it is incredibly personal. My mother is a breast cancer survivor twice. And in that sense, I have a very strong family history of breast cancer. I have one child who's my daughter, and she has family history on both sides, her father's side and her mother's side. So the research that Hwang is doing is going to impact her. It's going to impact her in terms of knowing what her risks are, what she should do in later life when it comes to focusing on that risk and knowing what are the options that she has available. I think I come from that privileged minority that have such a huge network around me to assist me in making these decisions. But for the majority of women out there, they don't have that. They're out there isolated in barren land, in a foreign land of talk about types of breast cancer, BRCA gene, of all these different things. Right. And they don't know where to go and don't know what to do. And so that's why the National Cancer Society is there. That's where we are. We have been talking about the macro level a lot, but on the micro level, on the individual, we can touch every single individual who has had breast cancer. We can make a difference to their lives, and that's what drives me.
I think progress and being able to make a difference is what drives me and the organization, right? So we started our research in 2003 in breast cancer with just recruiting 10 women to a genetic study. Today we're the largest Asian genetic study in the world, and we led some of the largest studies in the world to develop tools that will be useful for the Asian population. In 2012, we decided, okay, we'll collect tissue samples with permission from breast cancer patients when they were undergoing surgery. Some of the surplus material that wasn't needed for diagnosis, in a sense they were being thrown away, we were collecting them for research. And from there we built the largest genomic map and did all of this clinical research and take some of the discoveries from a lab to the clinic to really think about, okay, can we use immunotherapy for specific breast cancer patients? Will it improve their outcome? Can we use PARP inhibitors for other patients? Will they improve their outcome? And then finally, through our patient navigation program, having raised money from a golf tournament, wear a lot of pink clothes to raise a lot of money.
So as you can see, she has a lot of pink, while I'm more muted in my pink.
And to kind of having one center and then now 4 centers, and with support from Yayasan Saunthari and Yayasan Petronas, potentially 1 patient navigation center in every hospital in every state in the country. I think it's that progress and the opportunity to do more in a way that delivers results is hugely addictive, because you know that the work that you do can make a difference.
I want to come back to cost, as you've mentioned, touching every life, and that the work does go far, long way to make a difference. But cost allocation and budget as well, these are things that matter because they trickle down once again to the ground level. What do you have to say about the current budget allocation and what can be done better?
I think we could go on for hours on this. But I think that primarily is that there isn't enough cost allocation to breast cancer. Knowing that it's one of the most curable cancers out there, you should be pumping money to make that viable. Now, in terms of drugs, there are drugs out there which are not that expensive, but can make a huge difference in terms of life, and they're not available. in government hospitals. In terms of screening, in terms of early detection, there are no national programs out there in terms of screening and early detection. Our NCSM Massacre program is the largest breast screening program in Malaysia.
So you just mentioned meds earlier that are affordable. Are we buying them enough? Are we procuring them?
No, we're not. We're not purchasing them enough. That's honest truth, is that we're not purchasing enough drugs for the number of patients. And knowing that now patients, because of COVID, because of the financial constrictions that people have, many of them are off the insurance now, and they're going from private sector into the public healthcare system. And in the public healthcare system, if you don't have sufficient drugs, patients are not being treated in the timely manner and the best manner that they can be. We have patient assistance programs at NCSM where we actually can procure drugs at a much cheaper cost, which we provide for these patients so that they can be treated in government hospitals.
But it's not a problem of the healthcare system. I think we need to be really clear that this is not a problem of the healthcare system, in that we have really good policy makers. We also have very good doctors. We have incredible nurses and etc. Right? The whole system actually works. It's just there's not enough money going into the system.
It's not
the harsh reality is that the cost of therapies is outstripping our ability to pay for it. And the healthcare system of old that we wanted, where everything is free at the point of consumption, is unrealistic. So that's where I think Malaysians, the average Malaysian, really needs to think about, because this is unsustainable not just for us. It's not unsustainable for the UK, and they pay 50% personal tax. 50% of their personal income every month goes to taxes, and even then, the National Health Service is undersourced. Right? We pay 20-something percent
We
tax.
need to be more proactive.
We just don't have enough money in the system.
Right. So, in that perspective, what would you say are the next best steps for the medical fraternity?
I think that there are opportunities where we need to figure out how do we do health financing better. And I think there have been many attempts by sequential governments to try and figure out this hot potato. But this hot potato is really hard to handle at a time of political instability.
There needs to be political will, which goes across any party. It's not looking at, this party advocates this, the next party advocates something different.
Right.
Everyone should be on the same page in terms of what they advocate, which is more financing.
Which I think is really nice that, in the last election, general election, all three major parties came out to say that, they wanted to see a future where 5% of the country's GDP is invested in health. And that was from a starting point of about 2.5, 2.8%. That target is fantastic. So the question is, how do we get there? And how quickly can we get there? It's not about how to get there, but how quickly can we get there? Because until we do that, the healthcare system is going to continue to be broken.
From this point, looking forward in terms of future goals, looking ahead, what specific milestones do you think we need to get to, or specific goals that should be within our direction?
Other than the financing, I think the first thing is downgrading. Downstaging of the breast cancer cases, because we know we can find it early. But if more than 50% or 40-something percent are being found in stage 3, stage 4, we're not getting there. And then it's the accumulated cost of trying to treat patients at that stage. So it's actually downgrading. It's pushing out more screening programs like the Etika and CSM program that we have. It's getting more people doing private-public partnerships, utilizing what resources are out there, because the private sector actually has a huge amount of resources which are being underutilized, while the public sector is overutilized. So it's working on those partnerships to move patients into the private sector at a lower cost so that we can utilize and we can actually give timely access to patients.
Well, I would like to see in my lifetime, hopefully, that the gap in survival between the rich and the poor just reduces, right? So if today we have 90% of women, high-income women, are able to achieve 5-year survival, I hope that becomes 100% 5-year survival in the next 5 to 10 years. Yeah. But what I would also like to see is that the gap between that and low-income patients having only potentially 50% survival, that really needs to increase, maybe to 70% in the next 10 years. How do we make that happen? And I think we need to recognize that it's not a one solution for everything. We need early detection, not always just mammography screening, but early detection. We also need better access to treatment. We need to address the barriers that low-income patients face, such as through our navigation programs.
Thank you very much, doctors, for being here with me and sharing insights and perspective, of course, based on research as well, on how to raise breast cancer awareness and how we move forward. Also remember that approximately 0.5 to 1% of breast cancer occurs in men as well. Well, it's a disease that affects many lives, but awareness and early detection does make a difference. We urge you to stay informed, support those battling breast cancer, and prioritize your health. I'm Jessie Chahal. Keep thinking Pink October. Bye-bye.